today I'm happy to have Dr. J.T. Williams with us. A little bit about J.T. He was born and raised in Maysville, Kentucky, completing his undergraduate work at Transylvania University in Lexington, Kentucky. He attended the University of Kentucky doing graduate work in medical microbiology and immunology. He was the University of Tennessee College of Veterinary Medicine, class of 1993, and began practicing at his current clinic, Colonial Heights Vet Clinic, in 1993. He bought half the practice in 1996 and the rest in 2001, where he has managed it successfully ever since. If you are a Maysville local, I highly recommend taking your pets to JT at Colonial Heights Vet Clinic, and if you aren't, you can still check him out on Instagram at Vet in a Hat.
Anyway, JT, I'm very happy to have you here today. You bring a lot of experience to the table and have seen lots of cases of parvo, which is what we're talking about today. So, could you tell us a little bit about parvo disease and kind of what it affects and what it does?
Sure. First of all, thanks for having me back on, Nathan. I appreciate the opportunity to be on your podcast. I'll kind of give you my Parvo speech as it has evolved over the years as I give it to clients. Parvo is a virus, which sometimes you have to explain that things like antibacterials, antibiotics aren't going to be effective against that because people automatically think if there's an infection, you get an antibiotic and that's going to cure it. But anyway, it's a viral disease that can be potentially fatal in dogs or canines, because the other canids can also get it. That is a very hardy virus, meaning that very little will kill it. Heat won't kill it, freezing won't kill it, normal disinfectants won't kill it. They do have some, veterinary grade disinfectants that will, and bleach will kill it. It's also a very sticky virus, so it's one that can be carried on your shoes or a dog's paws or whatever into the house and can therefore be obtained inside the house where I've had people come in and say, well, the dog has never hit the ground. Well, okay, but you have. So it invades, it gets in through it's the fecal oral route, so it's shed in a dog's stool, and the infectious particles are there and can survive for months, if not years, in the environment. And once a dog is exposed to it, and it's usually a puppy thing where their immune system is not mature yet, it basically primarily affects two organ systems. One, the intestinal system, which is going to be the symptoms that an owner is going to see, such as vomiting, diarrhea, anorexia. Then it's also going to affect the immune system, which will cause some lethargy and an immunocompromised situation, which the owner may not be, it may not be obvious to the owner, but it can cause other problems such as secondary infections. I once, for instance, saw a case, this was years ago, that the dog got parvo and then got distemper on top of it. And I would assume that was because its immune system, which is already not mature, then is compromised by the parvovirus and then got distemper on top. That dog didn't make it.
Now, do you see, you mentioned a lot of things, the diarrhea, vomiting. Does every dog get all of those?
So in my experience, the diarrhea is pretty consistent. Vomiting is quite common, but usually the first thing that people will come in for is the dog's not eating. And it usually will happen. They'll say it was fine last night, this morning, it's overnight. And that does happen. That's the way it works. And so sometimes the first thing is the vomiting. So they'll come in and they'll say, it's been vomiting, not eating. Does it have diarrhea? No. I usually tell them that it will. Once I have the parvo diagnosis, I'll say, well, you're going to have diarrhea. It's probably going to have blood in it and it's going to smell awful. And usually that occurs. So those two, the vomiting and diarrhea, well, three, not eating, are pretty much, the hallmarks. And then those things, other clinical signs will develop from that. such as dehydration,
Hmm.
because they're vomiting and having diarrhea and not drinking.
Yeah.
So, you have those issues. But those are the things that, in my experience, that the big three are not eating, diarrhea, and or vomiting.
And what ages are you usually seeing this in?
It's definitely a puppy disease that, although I have the oldest dog I've ever seen with it was 5, and it had not had any vaccines in its life. I've seen a couple of 2-year-olds, but mostly it's, the 2 to 6 month age group.
Which I think I agreed with that until like the last 2, maybe 3 months. I've seen, I think, 3 dogs. Well, in the last few weeks, at least 2 dogs, 11 years of age, um,
Wow.
that got this. And like you mentioned, and we'll talk a little bit more later, they were, if they were vaccinated, it was as a puppy and not in the last decade.
So I
Uh,
wonder if that's the case, because like we would in with the case of demodectic mange, I usually saw that in either puppies because their immune system wasn't mature, or the really old dog where the immune system is probably on the downhill side. You know what I mean?
yeah,
And
and
so
that's
maybe
kind
that's
of,
the same case in your case with an 11-year-old. Maybe its immune system was, in the sunset of its career and couldn't fight it off anymore.
and that's kind of my own spiel I've given. I've kind of adapted to that just weakened immune system, which mostly,
Yeah.
like you said, is puppies.
Yeah.
And going over cases of the last few months, I think I've seen as many older adult dogs as puppy cases. Now the puppies outnumber the adults because the
Right.
whole litter usually gets it. Or do you
Right.
usually see the whole litter getting it in your experience?
Yeah, most of the time it's the whole litter. You'll have one or two come in first, and then there's like, well, I have 3 more at home. They're okay right now, and then the next day they're not.
Yeah. Do you think one of the other things, I don't know if I know this, but there's different viral strains of parvo out there
Yeah, yeah.
that
They're
might affect the different ages?
as far as I understand, it's the canine parvovirus CPV2, which is the so if there's a two, there was a one. Um, but it's the two that is now the virulent strain, and then there's substrains A, B, and C. I think B is the one that causes most of the stuff that we see. But and I don't know if this is still the case, but when parvo's well, I was going to say a relatively young disease, but it was when I was still in school, which was a long, long time ago at this point. So, but it mutated, I believe, from the feline parvovirus in the late 70s.
Okay.
So that was, and back then it was just wiping out dogs because, they didn't know what it was, they didn't have a vaccine, blah, blah, blah. But early in my career and at school, I remember hearing of cases where, and I believe I've seen a few, not recently, but years ago, where one of the strains would attack the cardiac muscle in the
Oh,
dogs, and they were dead within 24 hours. Nothing
wow.
you could do.
Yeah.
I don't know that I don't know that I saw that, but I remember learning about that, and I do believe I saw some cases because they were just
Hmm.
just different. So I don't know what, as far as different age groups, I don't know if any of the strains are more
Prevalent.
prevalent in certain age groups or not.
And our tests don't really
Right.
differentiate the strains and stuff. And
No.
at that point, it really doesn't matter. We've got parvo, we have to deal with it.
Right. Yeah.
I mean, what survival rates do you give people with this?
So and this has probably been probably 8 or 10 years ago. I actually did this, and it was my own cases. I went back and figured up my survival rate
Okay.
with ones that I treated. Now, I can't tell you if they were totally unvaccinated, if some of them, I didn't go into that much detail because I wanted to be able to say to the owners, if you
This
treat
is
this dog, it has whatever. And at that time, anyway, and again, that was years ago, and I haven't done it since, it was about 80% if they
okay.
treat it.
Yeah.
Of course, I don't know if they didn't treat because sometimes you would never hear back, so you don't know if they lived or not.
Yeah.
But what I could say was if you do everything, follow my treatment,
Yeah.
then there's an 80% chance. And the other thing was, and I don't think this is just me, I think this is kind of it, but 3 days from the
Yeah.
onset of symptoms. If they were if they made it 3 days, their chances went up
Yeah.
considerably.
And I know I've noticed the 3-day mark myself,
Yeah,
and I tell clients that I usually say 50-50. My feeling is maybe not quite the same as yours, but I feel
uh,
like we get more that once we start treatment, because I remember one of the last puppy groups, once we started treatment, we did pretty good, but the ones that died were the ones that did not, they died before my treatment could have effect.
yeah.
Um, so I
Now
think treatment definitely helps.
the other thing that yeah, because obviously there's some stray dogs out there that'll get it and they'll live,
Yeah, yeah,
and they don't even have the opportunity for treatment. So
yeah.
but
And they're
the other
spreading it.
thing, right? But they're spreading it. Yeah. The other thing that I will tell my clients is that it's a very difficult to predict as far as prognosis wise disease because
Yeah.
I have had dogs that have come in. I didn't think it was parvo, but we've tested. They seem perfectly fine, hydrated, whatever. They're dead the next day.
Yeah.
I've had other dogs that are lateral recumbency on the table.
Hmm.
I think they're going to die before I get this needle out, or get the catheter in them,
Yeah.
and then they live.
Yeah.
And I can't explain that. I think that's probably more a function of their own immune system than anything.
Yeah. And so I hedge my bets when I'm talking to clients. I'm usually saying
Sure.
50-50 survival
Yeah.
rate and stuff. But we're talking about survival. Is there a way to prevent this?
Yes, absolutely. A very good way. Because as I've already said, the avoidance of the causative agent is going to be impossible.
Hmm.
Although people still try it,
Yeah.
they think they do. But I tell them, they said, so I need to bleach my house, right? Well, you can if you want, but then you walk through your yard, and if there's virus there, you're tracking it back in.
Yeah.
So, but vaccines are the gold standard here. I mean, it's
Yeah.
to me the kind of the poster child of vaccinations. It's 95+% effective if done correctly, with a good vaccine and the correct timing. But that being said, because we don't know, we don't have a window into that dog's immune system at every point in time,
Hmm.
you're almost always going to have a window of opportunity for that parvovirus to be infectious in any particular animal at any particular time. So it's really a probability thing. You're given these shots at certain intervals, which has been determined that that's the best likelihood of hitting that dog at such a time where it will boost its immune system to prevent
So we don't
parvovirus.
just give one shot and it's done. We have a series
Correct.
of
Yeah.
for the
So
puppies. Yeah.
the maternal immunity that's passed to the puppies, we know lasts for 6 weeks, at least 6 weeks. After that, we don't know. In each individual puppy in a litter is going to be different. So it could last up to 20 weeks. So what we do is we recommend starting at 6 weeks, giving a parvo booster or parvo vaccine, and then every 3 to 4 weeks, and this has gone back and forth throughout my career, and not on the label, but I've been told every 3 to 4 weeks until they're 16 weeks old, and I've also been told every 3 to 4 weeks until they're 20 weeks old. And I've
Oh,
been I've been told that I've heard that at different lectures from different people, and so I typically go to this. Well, it kind of depends on when they start. If they start at 6 weeks,
yeah.
I will usually stop after they get one at 16.
Gotcha.
If they don't
Yeah.
start until 12, I might go to 20.
Yeah.
So
I'm usually trying to get at least 3
three,
doses.
yes,
Yeah.
three is kind of the magic number. Yeah.
Yeah. And as you mentioned, there's no point in vaccinating before 6 weeks because of the
No,
maternal
no. And
animal.
that's a little frustrating to me when I see people that have gotten puppies from different people that have already vaccinated them, which I don't have anything against if they're using a quality vaccine, they're doing it correctly, that kind of thing.
Yeah.
But when you start doing it at 4 weeks, you're wasting your money, and you could potentially, I
Uh,
think, maybe be doing harm.
I've seen it 2 weeks too, and
Yeah.
I
And then
just
they'll do it every 2 weeks. And it's,
yeah,
they
yes.
come to me at 8 weeks and they've had 4 shots.
Yeah. I'm like, I don't know that it's hurting, but I don't
But it's not
it's
helping for sure.
yeah, yeah. And then so how can we prevent parvo in those puppies since we can't vaccinate them in that window? Or is there a way that we can at least help try to prevent it?
Yeah, so I kind of assume that the mother has either already been vaccinated, which
Yeah.
sometimes I know, or if you have a dog that has not been vaccinated, if it was a stray, for instance, sometimes they will have acquired immunity, either from
Mm-hmm.
having the disease or whatever. So I've kind of always under the assumption that the mother has immunity that's going to be passed. That may
Oh,
not always be true, I understand. In the case where situation we were just talking about with breeders, those mothers are usually going to be vaccinated. So yeah,
yeah.
it's
Yeah.
important to have the mother vaccinated so we get that 6 weeks
Hmm.
of protection automatically.
Yeah. Yeah. Now, this probably sounds self-serving to veterinarians, but where would you recommend getting your vaccines from
Okay,
and
so
why?
vaccines are not prescription. So the public, general public can get the same vaccine we can. This is how it was explained to me one time. I'm going to say this, and I'm going to preface it by saying I don't know if this is true, is factual, but I was told that the vaccine manufacturers have to obviously prove their efficacy. So, and I'm just throwing numbers out. These aren't true numbers, but there has to be a certain minimum of virus particles, if you will, in this vaccine to be effective. Let's say it's 2 million. So I won't mention any trade names here, any names, but you, so you may go to a store and buy a canine parvo vaccine, generic name for, $3 or whatever it is, and it may have 2 million virus particles in there, which is be, it's going to pass regulations.
Yeah.
Whereas the better vaccines may have 15 million,
Yeah.
and it's going to cost more because of that. And you have the research and development and everything and brand behind that vaccine. So again, I don't know if that's true or not, but it makes sense to me. And it's just like anything, it's you kind of get what you pay for. So, and I have certainly seen dogs, plenty of dogs that have been vaccinated, some at the correct intervals, but with in my opinion, less than quality vaccine come in with parvo.
Yeah. And I also know people who work at feed stores where these vaccines are brought in, and they've said, oh yeah, they just sit out on the dock or
Yeah,
before, so these vaccines aren't being properly stored sometimes, and
right.
that affects the efficacy too. um,
Absolutely.
I can pretty much say the dogs that I know that I have vaccinated are not coming down with parvo. And if
Right.
they do, I'm very happy that we've tested this before. The drug companies we use, BI is the one I use, and they
Yeah.
have they have guarantees that back their product, which is very helpful if there
Yeah.
are problems. The
Yeah.
ones I've had to report to them are usually we're giving the vaccines, but the vaccines have not had time to work when the dog gets.
Right. I had a case here recently that I had a litter of puppies that I vaccinated, and some of them came down with it. It was less than a week. So
Mhm.
the vaccine hadn't had a chance to.
Yeah, because it takes at least 2 weeks to have
Yeah.
effect. And we've already talked about how the immunity changes through their
Right.
age. We don't know that we're getting all the effects with just the one vaccine. That's why we do the multiple rounds.
Exactly.
So we've talked about preventing parvo. Hopefully, we can prevent it and get people to do it because it's a devastating disease. We also
Yes,
talked about how many, can die, and without treatment, even more die. But
right.
how do you treat parvo in your clinic?
So this has changed a bit over the years, but the mainstay, the two things that are going to kill a dog that has parvo, number one is dehydration,
Hmm.
and number two is the weakened immunity. So, there's no, as we've said before, there's no miracle antibiotic or antiviral drug right now that's going to kill it. So supportive care is the mainstay. Fluids, number one. IV, if the owner is willing to do that, hospitalize the dog and have it hooked up, that kind of thing. Sub-Q if not. The other thing is if they are vomiting, is to try to prevent that because they'll really the electrolyte imbalance will be caused by that, and also dehydration will accelerate. I typically do not do anything for the diarrhea.
Oh, okay.
Um, it's just, it's if they're sick to their stomach, they're not going to tolerate it.
Hmm.
I just have not had, I don't want to say I've not had any luck. I was taught not to not worry about it, but it's the vomiting is the one that's going to get you. It is going to resolve once if they get over parvo.
Yeah.
I give antibiotics, not in the, again, thought that I'm going to get rid of the parvovirus, but to try to prevent any secondary bacterial infections, such as a
Yeah.
pneumonia, for instance. So anti-vomiting, antibacterial. There is a new treatment that I have not had a chance to try yet, but I will whenever I do. But those are the main, with fluids being number one by far.
Yeah. 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 And do you usually keep in hospital?
Usually not, but that's usually by the owner's choice. And a lot of
Gotcha.
times it will depend on, I don't have a 24-hour staff.
Yeah.
So if it's on towards the end of the week, I don't want them to be there because they need, they
Or-
would need more attention than I can give them. Most of the time nowadays, especially, people
Yeah.
elect to take them home.
I found it interesting because when I opened up my brick and mortar and started seeing parvo cases, I kind of made a conscious decision not to have animals overnight. So I said, what do
Uh-huh.
I do with parvo cases? And I basically sub Q fluids versus IV
Mhm.
and all the same things you did, make as much injectable as I can
Yeah,
and teach the owner how to give fluids at home.
yeah.
And I was like, this just seems to be the way I'm going to do it. I don't feel like from working at your clinic and others that the survival rates went down from that.
No, I would
Um,
agree with it. I would agree. Yeah.
yeah, and I think a lot of my clients like working to help save their pet, um,
Yeah.
and save some expense as well. So I think it's
Right.
worked out for the most part. It's still hard for clients to manage such a disease at home. I always offer that they can go to one of the overnight clinics, but I don't like having animals in the clinic when no one's around and stuff.
Yeah, I agree.
And then I thought I made this up and it was really cutting edge. And apparently there's like I think it's the Colorado method or something. They came up with it at a vet school too. And I'm like, oh, well, I'm glad someone else thought of it.
Yeah.
I do add metronidazole for the diarrhea a lot, also some for the infection. I'm curious now if that makes as much of a deal as not. The students that I have, they keep asking me, do you feed it or not feed it?
Yeah,
What?
and that's something that I never did. And then I've heard more of a push that you're supposed to get them back on food as soon as possible.
Yeah,
Um, to me, I still don't push it. And I tell the owners that, when they get hungry again, they're
they'll,
really going to be hungry. So just don't let them eat too much.
yeah,
But you want them to eat. So it's to me, it was always kind of a let the patient
self
determine.
self-regulatory. And
Yeah.
I send fluids with dextrose home most times, so they're getting some energy being
Uh-huh.
absorbed. is not a
Yeah.
lot, but I find, yeah, the students seem really, because I usually say if they're vomiting, don't feed them. And then
Yeah.
once they stop vomiting, let them eat if they want.
Yeah.
So,
Yeah.
and they seem really taken aback by that.
Huh.
So, but
Well,
because I think they're pushing at school to feed them
to feed them.
more.
Yeah. I had
Um,
read that. Yeah.
yeah, so I guess that's something that, uh, I don't usually stop people either. So,
Right.
if doing stuff.
Yeah.
Can this be expensive? We've talked about a few different ways, and one of the other ways is I tell people you can go to a 24/7 where someone is watching this
Yeah.
animal every minute of the day, which has benefits, but on the flip side, that is going to be expensive. Is this an
Yeah.
expensive disease to treat?
I mean, it used to be, I have to say, when I first got out, it was one of the most expensive to treat. I do believe relatively it
Hmm.
has gotten less expensive. The dollar numbers have gone up, but some other things have surpassed it, if that
Hmm.
makes sense, relatively. But yeah, I mean, it can still be expensive. There's no
Yeah.
doubt. The new treatment, the new drug that I told you that I mentioned, one vial of it costs, you know,
Yeah. Yeah.
so, but it's a one-time treatment too, and you're not supposed to have to do anything else. So again, if you're looking
Yeah.
at in the old days, if I did do IV fluids, 3 days hospitalization, the antibiotics that I would have to give 2 and 3 times a day versus some that now, the vomiting medicine that I would have to give more than I do now, it would be that
Yeah.
much more labor intensive, 3 days of hospitalization. So, and again, that's relative too. I've had people
Yeah.
say, "Oh, I thought it was going to be $2,000 when I say 500."
Yeah.
And other ones are like, "Oh, 500 is too much." So, yeah,
That new Parvo treatment cost a lot of money, which has been very prohibitive for my clients that I've offered it to and stuff. So it would be easier to just vaccinate because the vaccines are cheaper and
yes,
prevent all of this. So
absolutely.
now, what about animals at home? You kind of mentioned it earlier. You said bleach and some stuff, but
Yeah.
what kills Parvo? How can we take care of Parvo at home?
So diluted bleach is definitely the way to go. There are other. It has to be more than just Lysol. It has to be a medical grade disinfectant, but people can certainly get that. But again, I personally don't stress that because you take
It's
that dog home and wherever it goes to the bathroom, you're going to have parvovirus. Now you should obviously clean that up,
yeah,
but it doesn't mean that, I mean, even then they go outside, they're going to be exposed to it. I mean, it's like you said, vaccine is the way to go here, no doubt.
yeah. And I think sunlight kills it too. But when I tell people that, I'm like, sunlight doesn't get down in the ground, where virus is hiding beneath the ground. And when it rains, it's going to be come right back up, and then your dog's walking out in it again. So
Right, exactly. Yeah.
we're never going to get parvo out of the world. So
No.
protecting the dog to me is the way to go and stuff.
Yeah.
Any closing thoughts about Parvo? Anything else that we just want clients to know? Or
I mean, a thing that I think the thing that we have kind of hammered home is, vaccinate, vaccinate, vaccinate. It's a good vaccine. It's a safe vaccine. There are some vaccines that, you will have a little bit more likelihood of having a vaccine reaction to. I don't know that I've ever seen one to the
to
Parvo vaccine that I could, pinpoint to that.
yeah,
Because, a lot of times the Parvo um, is in a vaccine, a multivalent vaccine where you have adenovirus, parainfluenza, and distemper,
yeah,
and in some lepto too. So, if you're given that, if it has a reaction, you don't really know which one it is.
hmm
But to be quite honest, it's probably not going to be Parvo,
probably
the Parvo
yeah.
part of it.
And I always tell people too, just because your animal has parvo, get the vaccine when it's safe to vaccinate again. Because
Right,
there are you'll have immunity for a while, not forever, but for a while. And you want to get immunity from the vaccine from the other things in the combo that you
right.
mentioned and stuff.
Yeah,
So
yeah,
we still want to vaccinate even if your dog had parvo.
exactly. Yeah.
But yeah, otherwise, thanks for being on talking about parvo. It's something, it's just a devastating disease and we can prevent it. So I appreciate
Yep.
you sharing. Don't forget to check out Vet in a Hat on Instagram. And otherwise, if you're in Maysville, I would definitely recommend Colonial Heights Vet Clinic.
Appreciate it, Nathan. It's good talking to you.
I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving perspective. If you want to contact us, please reach out to theveterinarianpodcast@gmail.com. You can find a complete list of the podcast episodes on SoundCloud. If you find this information helpful and want more content, please join our Patreon, patreon.com/theveterinarypodcast. And don't forget to follow our Facebook page, facebook.com/theveterinarypodcast. As always, thanks for listening, and I hope this information is helpful to you. If you do find it helpful, please like it, share it, so other people may find it helpful as well.